What your doctor's words actually do to your body. Your doctor's choice of words has more impact on your recovery than you think, and most of them have no idea they're doing it. Think about two patients, same age, same diagnosis, same treatment plan. Both walk into their doctor's office with identical test results showing early-stage hypertension. The first doctor says, "Your blood pressure is a bit high, but this is very manageable. We'll start you on a low dose of medication, and with some lifestyle adjustments, most people see excellent results within a few months. You're catching this early, which puts you in a great position." The second doctor says, "Your blood pressure is dangerously elevated. Without aggressive treatment, you're looking at serious cardiovascular complications. This medication has significant side effects that affect most patients, and you'll need to completely overhaul your lifestyle if you want to avoid a heart attack." Same condition, same treatment. But here's what happens next. And this isn't speculation, this is documented medical research. The first patient starts the medication, makes gradual diet changes, and sees steady improvement. Side effects are minimal. Blood pressure normalizes within 3 months. The second patient immediately develops fatigue and digestive issues, as mentioned. Anxiety about their condition interferes with sleep. Blood pressure remains stubborn despite identical treatment. Recovery takes twice as long. The only variable that changed: the words their doctors used. Not the medical facts, not the treatment plan, just the way information was delivered. Your brain doesn't distinguish between a doctor's warning and a medical reality. When your physician tells you what to expect, your body often delivers exactly that. This isn't positive thinking nonsense. This is measurable, biological change triggered by expectation. Welcome to Keys to the Psyche, where you learn more about yourself and others. Most doctors have no clue they're doing this. Medical school teaches diagnosis and treatment protocols. Nobody teaches them that their communication style can literally alter your physiology. But your recovery isn't just about the medicine you take. It's about the mental framework your doctor builds around that medicine. The medical conversations that made you sicker. You've experienced this. You just didn't realize what was happening. Think back to the last time a doctor rattled off a list of side effects. This medication might cause nausea, fatigue, headaches, and digestive issues. You nodded, took the prescription, and within days, boom, nausea hits. Fatigue sets in. Your head starts pounding. Coincidence? Your body would say otherwise. Or remember that specialist who delivered your diagnosis like a death sentence? Heavy sighs, furrowed brow, the whole "I'm sorry to have to tell you this" routine. You walked out feeling worse than when you walked in, even though nothing about your actual condition had changed. Just the way someone talked about it. Here's what you don't realize. Your nervous system can't tell the difference between a doctor's warning and medical reality. When they paint that picture of what to expect, your brain files it under "things that will happen to me." Not things that might happen, will happen. You've probably blamed yourself for being weak or susceptible to side effects. Wrong. You're responding exactly as human biology is designed to respond. Your doctor just activated your body's expectation system without meaning to. Even worse, the medical jargon that sounds important but leaves you completely lost. Your inflammatory markers are elevated, and we're seeing some concerning patterns in your lipid panel. You smile and nod because you don't want to seem stupid, but your brain translates confusing medical speak into one simple message: something is very wrong with me. That anxiety you feel after medical appointments isn't weakness. It's your mind trying to make sense of information that was delivered in a way guaranteed to trigger your threat detection system. This is literally damaging your body. When your doctor warns you about side effects, your body starts preparing to experience them. This isn't psychology, it's measurable physiology. Your immune system weakens, your pain receptors become more sensitive, your stress hormones spike before you even take the first pill. Think about what that means. You're literally getting sicker from the conversation itself. The research on this is brutal. Patients who receive pessimistic prognoses show slower wound healing, higher inflammation markers, and worse treatment outcomes, even when their actual medical condition is identical to patients who heard more neutral information. Your cells are listening to every word your doctor says. But here's what makes this worse. Most doctors have no idea they're doing this to you. Medical school teaches them to diagnose and treat diseases. Nobody taught them that their delivery style directly affects your recovery time. They think being thorough means listing every possible complication. They think preparing you for the worst is somehow protecting you. Wrong. They're accidentally programming your nervous system for failure. This isn't about pretending cancer away with positive thoughts. That's nonsense. But when a doctor delivers real medical information in a way that triggers your body's threat response, you end up fighting two battles instead of one. The actual condition, plus the anxiety and physical stress their communication style created. You're not getting the outcomes you could be getting, and you don't even know it's happening. The science your doctor never learned. Here's what most people don't know about placebo effects. They work in reverse, too. The nocebo effect, that's what researchers call it when negative expectations make you physically worse. Same biological mechanisms as a placebo, just flipped. Your brain expects pain, so your pain receptors fire harder. You anticipate nausea, so your digestive system starts churning before you even take the medication. This isn't some fringe theory. Major medical journals have documented this for decades. When patients are told a procedure will be extremely painful, their pain scores jump 30 to 40% compared to patients who heard the same procedure described as uncomfortable but manageable. Same surgery, same recovery process, different words from the doctor. The mechanism is brutally simple. Expectation changes brain chemistry. Stress hormones spike when you hear doom and gloom delivery. Your inflammatory response kicks into overdrive. Blood pressure climbs just from the conversation itself. But here's the frustrating part. At 2:30, I'll show you the exact questions that protect you from this. Because most doctors creating these problems have no clue they're doing it. The medical school curriculum is the issue. 4 years of learning anatomy, pharmacology, and diagnostic procedures. Maybe 6 hours total on patient communication. Nobody taught them that their word choice directly affects their cortisol levels. They think being thorough means listing every possible side effect in the most clinical language possible. Wrong approach entirely. They're accidentally programming your nervous system before treatment even starts. Some doctors figure this out naturally. They develop instincts about delivery style through experience. But the majority? They're operating blind to their own psychological impact. Your healing response gets sabotaged by someone who genuinely wants to help you. You're not powerless here, though. The biology works both ways. How to hijack your doctor's communication before it hijacks you. You control more of this interaction than you realize. First principle. Treat medical conversations as data transfer, not prophecy. When your doctor says, this medication causes nausea in 30% of patients, your brain hears, you will be nauseous. Wrong interpretation entirely. The actual data point? 70% of people taking this medication feel fine. Same information, different frame. Your nervous system responds to the frame, not the facts. Here is your first tactical question. Doctor, What percentage of patients handle this treatment without major side effects? Forces them to flip the statistic. Instead of hearing about the 20% who struggle, you get the data about the 80% who do well. Same numbers, opposite neurological programming. Your second question reshapes the entire dynamic. What are the early signs that this treatment is working for me? Now you're primed to notice positive changes instead of scanning for problems. Your attention becomes your ally instead of your enemy. But wait, actually, let me give you the most powerful reframe of all. Separate the medical facts from the delivery style completely. When your doctor uses dramatic language like extremely serious condition or unfortunately the prognosis is, strip out the emotional packaging. Ask yourself, what is the actual medical information buried under their word choice? Maybe they said, unfortunately, you'll need surgery within 6 months. The medical fact? You need surgery within 6 months. The emotional baggage? Unfortunately. Their delivery created doom where none existed in the data itself. Here's a story that shows this in action. I know a woman, call her Sarah, who got diagnosed with a thyroid condition. The first doctor told her, this is a chronic disease that will control your life. You'll need medication forever, and many patients struggle with weight gain, fatigue, and depression. Sarah felt devastated, started researching support groups for people struggling with thyroid disease. Second opinion, different doctor. Same diagnosis, completely different delivery. We caught this early, which is excellent news. The medication is highly effective, and most of my patients live completely normal lives. We'll monitor your levels and adjust as needed. Same medical condition, same treatment plan. Sarah's stress response? Night and day difference. She approached treatment as management, not survival. You build your own narrative from the same medical facts. The question becomes, what story serves your healing better? The one where you're battling a serious condition, or the one where you're managing a treatable issue? This isn't about denial or positive thinking curing cancer. This is about not letting poor communication sabotage legitimate medical treatment. Your doctor gives you facts. You decide how those facts get processed by your nervous system. The brutal truth? Most doctors accidentally program you for worse outcomes through clumsy delivery. You can reprogram yourself for better ones through better questions and better frames. The research that changes everything. The data on this is staggering. The 2012 study in the New England Journal of Medicine tracked over 3,000 patients receiving the same heart medication. Half got it with detailed side effect warnings, half got it with minimal warnings. The group with detailed warnings? 40% higher dropout rates due to unbearable side effects. Same drug, same dosage, different expectations. Here's where it gets serious. Researchers at Harvard Medical School found that patients who received pessimistic prognoses showed measurably slower wound healing. Not psychology, actual tissue repair rates. Your doctor's delivery style literally affects your cellular recovery. Another study followed cancer patients through chemotherapy. Those whose doctors used phrases like fighting a battle and aggressive treatment reported 30% more severe side effects than patients whose doctors framed it as supporting your body's healing process. The nocebo effect isn't some fringe concept. It's documented across thousands of studies. When doctors tell patients, this will make you nauseous, nausea rates spike by 60% compared to neutral delivery. I watched this happen with my own father. The first oncologist told him he had months, maybe a year if we're lucky. He declined rapidly, stopped eating, and gave up his hobbies. Second opinion, different approach. We have excellent treatment options, and many patients live full lives for years. Same cancer stage, same prognosis. My father started planning trips again. The mechanism is measurable. Negative medical communication triggers your sympathetic nervous system, floods your body with stress hormones, and suppresses immune function. Your doctor's words become your body's instructions. You're not imagining this. Your nervous system is responding to linguistic programming just like it would to any other stressor. The question becomes, are you going to let poor communication sabotage your healing? You're not a victim of your doctor's words. Here's what you don't realize. Every medical conversation is a negotiation, not a monologue. Your doctor presents information. You decide how that information lives in your body. The brutal truth? Most patients sit there passively, absorbing every doom-laden word like gospel truth. That stops now. Medical facts exist. Your doctor's interpretation of those facts? That's storytelling. When a doctor says, "This is aggressive," versus, "We're going to be proactive," they're choosing narrative frames. Same data, different psychological impact. You get to participate in that choice. Start asking different questions. Instead of, "How bad is it?" try, "What are my best case outcomes?" Instead of accepting, "You'll probably experience nausea," ask, "What percentage of patients don't get nauseous, and what do they do differently?" This isn't denial. This is taking back some control over how medical information affects your nervous system. Your doctor controls the diagnosis. You control how you process it. I've seen patients transform their medical experiences just by becoming active participants instead of passive recipients. They ask for neutral language. They request statistics instead of predictions. They reframe problems as challenges with solutions. Your healing doesn't just happen in the treatment room. It happens in how you carry those medical conversations in your mind afterward. That part? That's entirely yours. Your next doctor's visit changes everything. Here's your assignment. Pick one strategy from today and use it at your next medical appointment. Just one. Maybe it's asking, what percentage of patients don't experience that side effect, instead of nodding when they list everything that could go wrong. Maybe it's requesting they explain your test results in neutral language instead of loaded terms. Start small. You're not rewriting medical science. You're reclaiming your role in how medical information affects your mind and body. Are the doctors who get frustrated by these questions? They're revealing something about themselves, not about you. The good ones welcome an engaged patient who wants to understand their own care. Your health isn't just what happens in the examination room. It's how you carry those conversations afterward. How do you process that information? How do you let it shape your expectations and your healing? That part has always belonged to you. If this shifted how you think about medical interactions, there's more psychology like this on the channel. Hit subscribe. Your future self will thank you when you walk into that next appointment knowing you're not just a passive recipient of medical pronouncements. You're an active participant in your own healing. Act like it.